Alright, so I'm going to scan my room to show that there's not any notes. Okay. There. Okay, so before I go on my patient's room, I'm going to check the chart. I'm going to walk in, knock on the door. Hi, my name is Michaela, and I'm going to be your nurse today doing an assessment on you. I'm then going to wash my hands, provide for privacy for my patient, and then identify her with 2 patient identifiers. So can I see your wristband? And can you tell me your name and date of birth?
Rachel Wetzel, 5395.
Perfect. And can you tell me why you're here today?
Checkup.
Okay. And are you in any pain?
No.
Okay. So my patient states that she is not in any pain. If she was, I would assess using the PQRST method. I'm going to start off with inspecting your neck. So I'm going to go have you lay down flat for me, and I'm going to be inspecting for any jugular vein distension. Okay, so I do not note any jugular vein distension with her laying flat, so I'm going to check it at 45 degrees. Perfect. So there is no jugular vein distension noted at all. You can go ahead and sit up for me. Next, I'm going to palpate her carotid arteries. Good, so those are both about a 2+, and they are equal bilaterally. Do you have any neck pain?
No.
Do you have any stiffness in your neck?
No.
And do you have any limited range of motion in your neck?
No.
Okay, so I am going to move forward, and I'm going to listen for any bruise in her neck. So go ahead and hold your breath for me when you're ready. All right, go ahead and breathe. Moving to the other side. Go ahead and hold your breath again when you're ready. Perfect, so there were no bruise noted. Next, I'm going to check for turgor by just pinching the skin right above her clavicle, and it went right back, so there is no tenting noted. So moving forward, I'm going to move on to her upper extremities, so her arms. Just by generally inspecting her arms, they are symmetrical, and the color is appropriate for her ethnicity. Do you have any limited range of motion in your arms?
No.
And do you experience any numbness or tingling in your arms? Okay, so I'm going to go ahead and palpate for temperature. Put your arms down here for me. Temperature and texture. Perfect. So she is, or her skin is warm and dry as it should be. I am next going to go ahead and palpate for any swelling or edema, and go ahead and let me know if there's any tenderness.
No tenderness.
Perfect. So patient states that there is no tenderness, there is no swelling or edema noted, as well as no masses or lesions as well. So next I am going to palpate your radial and brachial pulses. Good. Good. So both of those were about a 2+, and were also equal bilaterally. Next, I am going to check your capillary refill in your fingernails by just slightly pinching your fingers. Good, so those returned in less than 3 seconds, so that is a normal finding. Lastly, for the arms, I'm going to go ahead and test your strength. So can you squeeze your finger, or squeeze my fingers? Go ahead and pull my hands towards you and push them away. Good. So there is no limitations or in her strength, and it is all equal bilaterally. So moving on down to her lower extremities, her legs. Can you go ahead and pull your pant legs up for me? Perfect. So do you have any pain in your legs while sitting, walking, or standing?
No.
Okay. And do you have any numbness or tingling in your legs?
No.
Okay. So just by generally inspecting her legs, they are symmetrical. The color is appropriate for her ethnicity still. And I'm next going to go ahead and palpate for temperature and texture. Good, so her skin is warm and dry, and the hair also seems to be distributed evenly on her legs. Next, I'm going to palpate for any edema or swelling. Let me know if there's any tenderness.
No.
Okay, patient states that there is no tenderness, and there is no edema, no swelling, as well as no masses or lesions noted on her legs. Next, I'm going to check the capillary refill in your toes the same way I did your fingers. Perfect. So those returned in less than 3 seconds, so that is a normal finding. I am now going to palpate her all her pulses in her legs. So first, starting with the popliteal behind the knees. All right, and then the posterior tibial, and then the dorsalis pedis on the top of her foot. Okay, so all three of those were a 2+ and were equal bilaterally. Next, I am going to test her strength in her legs as well as the perception. So can you lift your legs straight up for me? Good. Can you go ahead and pull them towards you and then push them back towards me? Good. So her strength is equal bilaterally. And next I'm going to test for the perception. So I'm going to have you close your eyes, and I'm going to touch the bottom of your foot with something sharp or dull, and you can go ahead and tell me which one you feel, okay?
Sharp. Dull. Sharp. Dull.
Okay, good. So both of those were indeed correct. So next, moving on to the anterior chest. Do you have any heart problems or have you ever had a heart attack?
No.
Do you have any problems breathing?
No.
Do you have a history of smoking or smoke now? Okay. So just by generally inspecting her chest, it appears to be symmetrical. There is no accessory muscles being used to breathe, as well as her breathing pattern seems to be normal. Next, I'm going to palpate for temperature and texture on the anterior chest. Good. So it is warm, dry. The skin is all intact. Next, I am going to percuss all of her lung fields. So I'm going to start here at the apex. Second intercostal space. Fourth intercostal space. Fifth intercostal space. And then the mid axillary at the sixth intercostal space. Perfect. So all of those sounds percussed were dull, low-pitched sounds. Next, I'm going to auscultate her lung fields in all of those same areas as well. Every time my stethoscope touches a new area, go ahead and take a deep breath for me, okay?
Okay.
Perfect. So all of her lung sounds were clear. There was no wheezes, crackles, or rhonchi noted. So next, moving on with the chest, I'm going to go ahead and listen to your heart sounds, okay? So first, I'm going to start out at the aortic, which is on the right sternal border, second intercostal space. Moving on to the pulmonic, which is on the left sternal border, second intercostal space. Moving on to Erb's point, which is left sternal border, third intercostal space. moving forward to the tricuspid, which is on the left sternal border, 5th intercostal space. And lastly, moving on to the mitral, which is the midclavicular line, 5th intercostal space. Perfect. So all of her, there was no adventitious sounds, and there was no murmurs noted there. Moving on to the posterior chest, I'm going to go ahead and have you turn around. So just first, by generally inspecting, the color is still appropriate for her ethnicity, and the posterior chest seems to be symmetrical. I'm now going to just palpate for temperature and texture. Good. So there is no, or her temperature is warm and dry, as it should be. Next, I'm going to check for the diameter. So it should be a 2-to-1 ratio. Perfect. So it is. Next, I'm going to go ahead and check for chest or symmetrical expansion by placing my hands at T10, and I'm going to go ahead and have you take a deep breath for me. Perfect. So both of my hands did rise symmetrically, which is a good finding. Next, I'm going to check for tactile fremitus. So I'm going to go ahead and place my hands down the back, and at each location, she's going to go ahead and say 99 for me. Go ahead.
99, 99, 99, 99.
Perfect. So with her saying that, that tells me that that the vibrations did diminish and there was no crepitus noted. Next, I am going to go ahead and percuss all of her lung fields. So starting with the apex, T2, T5, T7, and T10. Good, so all of those sounds were resonant, so a dull, low-pitched sound. Next, I'm going to auscultate in all of those same lung fields. So once again, every time my stethoscope touches you, go ahead and take a deep breath for me, okay?
Okay.
Perfect. So all of her lung sounds were clear on the posterior chest. There was no wheezes, crackles, or rhonchi noted. So you can go ahead and turn around for me. This completes my assessment. So thank you for participating and thank you for watching.